So this is the Rabies and Microchipping Clinic. We offer it one time a year, and it's when people can come and get rabies vaccines for their cats and dogs, or microchip if they so choose at a lower cost.
So the biggest benefit of microchipping pets is to be able to get them back to their owner should they be lost or get off leash or something while outside. Those are permanent, identification tags, unlike a collar or something that might come off. And as at VCA Brookline where I work, we act as the holding facility for any lost or stray pets in Brookline, Massachusetts. So if any pets were to be brought to us by the animal control officers, we're able to scan them and hopefully get them back to their owners pretty quickly. The biggest benefit of vaccination is preventing these diseases that we can prevent with vaccines, limiting risk of exposure and also protecting the humans on the other side of things. Many of us like to practice what we call fear-free medicine, where the goal of the appointments is not to cause stress, it's not to cause anxiety or fear. We're trying to always have them be happy appointments, positive experiences, lots of pets, lots of positive reinforcing words, lots of treats. The first thing I do when walking in the room is, I kneel down on the ground, get on the level of the animals, offer them lots of high-value treats, just try to make it as fun as possible. And then I always, for vaccines specifically, I always use the tiniest little needles I possibly can, just so I don't cause them any pain or discomfort. So all vaccines that we give to pets are repeating vaccines. So what that means is we typically start the booster series when they're quite young. While the maternal antibodies from their mother are waning, we want to be stimulating their immune system to keep them well protected. Typically we give the first rabies vaccine, right around 16 weeks old. That's then boosted again at 1 year. And then after that, for dogs at least, it's every 3 years. For cats, there are 2 different vaccines. One of them is a 1-year vaccine, one of them is a 3-year vaccine. So for those cats who really don't like to come to the vet, sometimes we'll do 3 years. But all vaccines that we give do need to be boosted at some point. I always promote 1-year vaccines because that encourages people to bring the cats back in on a yearly basis. So we can do things like annual blood work, physical exams, catch chronic diseases before they become big issues. For those cats who are very difficult to handle or don't tolerate coming to the vet, we could always do a 3-year vaccine to help decrease stress. But I'd still want to see that pet as frequently as possible just to keep track of the, long-term preventative wellness style of things, like catching kidney disease before it starts affecting the pet, catching things like hyperthyroidism or heart disease. Again, the goal is to catch those before the pet is sick from them.
So the BARC is a new part of the community emergency response team, and through the past few years it's really been recognized how important it is to make sure that pets are being taken care of in emergency situations for all sorts of different reasons. First of all, because they're animals and they deserve to be taken care of, but also because when people felt forced to leave their pets behind, they basically couldn't think of anything else other than whether their pets were okay. And so it's much better for the social and mental health of people in an emergency situation or a disaster to know that their pets are being taken care of. And so this is just a little corner of that that we're helping with in Brookline.
Be on the lookout for next year, and we really couldn't do this without the VCA. We really appreciate their partnership. So thank you. Get your dogs vaccinated and cats.